We all have that one song that we can just listen to on repeat. Now, I could ask you why you love that song, and your answer would probably be along the lines of it makes you feel good. But the real question is, how does that song make you feel so good? Hi, everyone. My name is Anika Vittel, and I'm here today to talk about understanding why music therapy is beneficial for autism spectrum disorder. The reason I chose my topic is because I've been doing music ever since I was young, and I also know people who have autism spectrum disorder, making this a very relevant topic for me. So first, let's start off with some background information. In the United States, 1 in 36 children are born with autism spectrum disorder, which I'll refer to as ASD. ASD is a neurodevelopmental disorder, and individuals with it often face difficulties in social communication and have restricted or repetitive behaviors. However, the cause of ASD isn't completely understood. Risk factors for developing ASD include genetic components, such as shared genetics, gene mutations, or heritability. A very common risk factor for ASD are rare de novo mutations, which are genetic mutations that arise spontaneously. When diagnosing ASD, researchers often look for copy number variants, or CNVs, which are mutations that occur as microduplications or microdeletions in genomes. More specifically, researchers look for rare de novo CNVs, since people with ASD tend to have an elevated rate of them. These factors play a major part in an individual's brain development, especially for those with ASD. As shown in the diagram, the main regions of the brain that are affected or disrupted by ASD are the prefrontal cortex, temporal lobe, amygdala, and more. These regions are important for social cognition, language, and the regulation of emotions, respectively. Compared to people with ASD, neurotypical people experience more activity in these regions, except for the temporal lobe, where there's generally more activity for a brain with ASD. Now that we're able to understand ASD a bit more, I want to now talk about the effect of music, starting with how music is normally integrated in a neurotypical individual. Music has a much greater effect on our brains and emotions than we may realize. It is processed in the auditory cortex, which is in the temporal lobe, while the amygdala and cerebellum are important for responding to it. The cerebellum is found in the back of our brain and is responsible for corresponding and regulating motor activity. It plays a critical role in rhythm perception, as this involves a large part of the motor system, especially when it comes to the ability to dance to music. On the other hand, the amygdala is associated with experiencing emotions, such as fear. It is also responsible for the emotions we feel while processing melodies. This is shown in a research effort which shows a phenomenon to enjoying music, as oftentimes when individuals listen to music, they experience the feelings best described as musical chills or shivers 77% of the time when listening to certain parts of songs. This feelings of chills is positive and shows extreme enjoyment from the listener. While this may just seem like a simple emotion, they found that as the feelings of chills increased, activity in the amygdala actually decreased. The chills have a connection to the amygdala's parts that could correspond to fear and negative emotion as activity decreases for those areas. This shows just how good music can make us feel and the intensity of the effect it has on our brain. Now, being able to understand the strong impact music has when normally integrated will help us better understand the impact it has on our brain with ASD. In ASD, music is integrated differently and also evokes different reactions. Studies have shown that music can produce strong and consistent positive or negative emotions in individuals with ASD, and possibly even stronger than neurotypical individuals. Furthermore, the neural connectivity underlying music processing includes a network of limbic and paralimbic structures, which are structures that have to do with feelings of reward and emotion. In ASD, the amygdala, hippocampus, parahippocampal gyrus, and many more brain regions were observed to be activated in response to music. Additionally, different types of music activate different brain regions. In an experiment with 22 individuals with and without ASD, participants were given stimuli consisting of 10 happy and sad musical excerpts each. It was found that happy music activated many more regions for an individual with ASD when compared to other types of music. The way these researchers measured brain activity was by measuring the blood oxygenation level dependent responses, or BOLD responses, through functional magnetic resonance imaging, also known as fMRIs. They found high BOLD responses, which means that they measured high amounts of blood flow and oxygen in the brain. By looking at the BOLD, researchers found that listening to music increased activity in the prefrontal cortex. This activity suggests a higher level of emotional processing in people with ASD, which could be linked to the feeling of reward in the limbic systems. This high bold was also seen in the cortical and subcortical brain regions, which show how music perception and emotional processing when music is being processed. This demonstrates how, although an individual with ASD may have trouble expressing themselves or being social, they're able to process music and feel a lot of emotion while listening to it, as brain activity increases greatly. Now, knowing the overall benefits of music on the brain, that information can be used for the benefit of people with ASD, as music is used in a form of therapy. Music therapy is an uncommon type of therapy that uses music to address emotional, physical, social, and cognitive needs. It can be a useful intervention since it can be individualized for a person's needs or even used as a group. In a study with 17 participants with ASD, they were randomized so that 8 followed a social skills group, or SSG, while the other 9 were assigned to a music therapy group, or MTG. During this time, each group followed the same processes, but the exercises would be specific to their type of therapy. For instance, in the sensory experience section, the SSG had a deep pressure regimen, while the MTG also had a deep pressure regimen, but with the added factor of song, as they would have squeezes that went along with the rhythm of a song. After completing the full MTG and SSG process, the chart on over here shows each group's social function on a social responsiveness scale over time. The lower the scores correlate with better social function. They found that the MTG had much lower scores, showing better social function, while the SSG scores actually increased instead. Overall, with music therapy, a person with ASD can practice open social interaction and individual skills better. Music therapy is extremely helpful as it improves social skills and joint attention for people with ASD. Studies have also shown that it specifically helps a lot in increasing eye contact and social engagement in a group setting. Within the brain, music therapy helps and affects the frontal lobe, auditory and visual cortices, the amygdala, and the frontotemporal and cortico-subcortical networks. Children with ASD tend to have less neural organization, which is the organization of structural, functional, and dynamical interactions in the brain, and a lack of that prevents them from healthily responding to their environment. Furthermore, it leads to underlying motor deficits, leading to an inability to plan, initiate, and complete a motor sequence. Therefore, music therapy can help because it has a rhythmic structure, providing clear cues for people with ASD to follow and even anticipate responses. Not only does music therapy provide a structured environment, but is also extremely flexible since it can be changed to fit what is most needed, which helps provide accommodations for a person with ASD. This helps to encourage a more creative or even non-musical response. fMRI studies have shown that music therapy increases auditory motor and subcortical connectivity, and this increased connectivity improves the top-down processing in a person with ASD. Top-down processing describes an order of processing information, which can be thought of as a sort of hierarchy. As shown in the image, higher up on this hierarchy is the thinking and feeling aspect of your brain, but as you go lower, it has more to do with sensing and responding. The near opposite is bottom-up responding, where the brain starts lower on the hierarchy with sensing or responding, then moves up to thinking and feeling after. So while top-down processing uses more prior knowledge to make inferences, bottom-up processing uses raw senses to come to conclusions without taking any prior knowledge or expectations into consideration. In AAC, there is more bottom-up processing, which causes an imbalance. Increasing the connectivity in the auditory motor and subcortical complexes helps to rebalance the trade-off between top-down and bottom-up processing. So overall, because of these imbalances, music therapy helps to balance any connectivity imbalances and pushes for more communication among neurons. This helps increase social interaction and emotional processing, which is something many with ASD struggle with. In conclusion, we found how music can affect our brain and how it does so even more in ASD. Today, I started off by sharing some causes and symptoms of ASD, the effects of music on a neurotypical brain compared to a brain with ASD, and lastly, how music therapy can be beneficial for people with ASD. In a more structured environment, music can strengthen the brain and its processing and help with behavioral responses. Furthermore, since ASD is in each individual can be different, music therapy is flexible since it can be used to respond to each individual's needs. It helps people with ASD identify and appropriately express their emotions. For these reasons, music therapy should be further studied and considered as a form of therapy for the benefit of individuals with ASD. Thank you for listening, and I hope you enjoyed.
Awesome. Thank you so much, Annika. That really fantastic presentation. One of the questions that came in was based on what you know about ASD, what qualities of the music, what qualities of the music played might increase the therapeutic effect in individuals with ASD?
Um, so I guess like um I think like the the reason that music is able to is very therapeutic for ASD is because of how people with ASD they usually take in emotional responses much more intensely than neurotypical individuals would. So music is a good way for them to really connect to it. And um, as I said before, in music therapy, you take advantage of that music by using rhythm and structure to make the music therapeutic. So it's not always the type of music, but it's also how the music is used that makes it
Hmm,
therapeutic for people with ASD.
interesting, because I think that what I've always heard and understood, especially about like brain development or children, if they listen to classical music,
Yeah.
that it's supposed to help their brains develop. I don't know if
Yes.
that's
Yes.
actually scientifically or grounded in science, or if
No.
that's just kind of an old wives' tale type of thing.
Yeah. Actually, that is mostly true. Like classical music does seem to have a much more beneficial effect for people. Yeah.
Got it. Thanks so much, Annika. Great
Yeah.
research.
Of course. Thank you.